been discussing on Newzroom Afrika in the last 24 hours the high number of COVID-19 infections among children in the third term of the year. Now, yesterday, the Eastern Cape confirmed to us that about 2,000 children have tested positive for the virus. That's since the beginning of August. About 158 teachers have also been infected over the same period. Now, here's the issue. Teachers have, in the main, been vaccinated. They've received a COVID-19 vaccine. But the country, like many others across the world, is yet to approve the vaccination of minors. But those in the late grades and who turned 18 while still in the school system are being encouraged to get vaccinated. Let's speak now to Professor Haroon Saloojee, a child health expert, to talk about the impact of COVID-19 on children. Prof, good afternoon. Grateful for your time. What is the general consensus now with children and COVID, especially given that we're dealing with this new highly infectious Delta variant?
Thank you very much for the invitations. So we recognize that the Delta wave, like in adults, is also more transmissible in children. And so the amount of children who've been infected during the third wave, during the Delta wave, is certainly more than the first and second. But the old trend where children were less likely to be infected than adults still remains true. So we still see many fewer children than we see adults getting the infection. And the other important fact is children get mild disease and not often get hospitalized and unusually die still remains true even for the Delta virus. So in summary, we are seeing more children compared to the previous waves, but we're not seeing a change in the trends. It's not more infectious in children. It's not affecting children more. And it still mostly is a mild disease in children.
And I referenced the Eastern Cape conversation that we had on the program yesterday, where the HOD was telling us that one of the issues they've picked up is that there's low adherence as far as the non-pharmaceutical interventions, the wearing of masks, social distancing, and the washing of hands in some instances. What can be done to get us back to the levels where we were as far as vigilance at the beginning of the pandemic especially?
Yeah, so that's a difficult question because it clearly depends on schools doing what they need to do. And I think the Department of Education has often said that this is not a major issue. So it obviously is very disappointing that in settings in the Eastern Cape or other parts of the country, they haven't been able to do the PPE, the protection. Obviously, part of that is because of fatigue. People have got tired of doing it. But I'm afraid at this stage, there's no magic bullets. The message that we gave last year is the same message as this year. Distancing is important. The masking is important, the ventilation is critical, and obviously hand hygiene is critical. So I'm afraid there's no different message than before. It's a matter of somehow keeping schools engaged.
There's also been some chatter from people in the education sector who say, listen, parents say they don't want to send their children to school for risk of COVID-19 infection, yet they still take these same children to socialize with family and friends, which does not necessarily mean there's lower risk of infection. What's your take on that argument?
Yeah, so I think that's the critical message. And the message is, where do children get infected? And now we've got evidence from South Africa and around the world for over the year that actually very few children get infected at schools. The place where most children get infected is either at home or in the communities. And it's exactly the same for teachers as well. If you look at most teacher infections, they get them either at home or in the community. So we now know this very well, that schools are not the major mode of transmission. Doesn't mean transmission doesn't happen at schools. And so we've looked at the South African data since last year, at the time when schools were closed and schools were open. And we see no correlation. We see no increase in the number of children getting infected when schools are open. What we see is that the amount of children that get infected is related to where we are in the bigger epidemics. So like we are now in the third wave, we will see more children. So that's a myth. And I think your point is absolutely correct. I've seen children playing in the streets during the peak of the third wave in Soweto where I work. And so I would argue that children are probably safer in schools because at least when they're in school, they're going through all these safety measures than when they're left to their own devices at home or playing in the streets or going to malls.
Government is still struggling or working towards vaccinating the majority of South Africa's adult population and appears, in fact, has said that at this point the vaccination of minors is not a priority, but should it be, given what's at stake as far as learning time and children, yes, not being the people who are worst affected physically by COVID-19, but having the likelihood of taking it back home and infecting adults?
So I fully agree with the government stance. Giving vaccinations to children is not a priority. In fact, if one looks around the world, the only place that's really giving children aged between 12 and 18 vaccines is the United States. Even countries like the United Kingdom and Australia are still debating whether they should be giving it to school children. So the question is, why is that the case? Why don't we think children are a priority? And it's for the reasons I think we're well aware of. Firstly, children get mild disease, that some of them do get sick, and a few of them get what's called the long COVID. They have long-term effects, and very few die. So the main reason for giving children is not really to protect them, because they get mild disease. It's to protect the community. That's the main argument. But in the South African setting, it's a straightforward argument. Our priority is to save lives, and to save lives, we have to vaccinate adults. Once we complete with that, we can start having this discussion. But it certainly is not a priority, and it's not something we should be taking on immediately. Certainly, as the Minister said in her speech this morning, any learner over the age of 18, we will get the vaccine. And one other key point is that there are some children, a very small number, who are high risk. Children with severe neurological disabilities, immunological deficiencies, severe heart and lung problems. And our association is saying those high-risk children between 12 and 18, we should consider giving them the vaccine. But that's a very small cohort. But there's absolutely no reason to be given all children, even children, older children, adolescents, the vaccine currently. You can't make the case.
Professor Haroon Saloojee, good to speak to you, sir. Thank you.
My pleasure. Thank you for the invite.